Hi everyone, welcome to your caring and nursing lecture. This lecture will cover most of the key concepts from your readings, but please go ahead and look in your module and complete the assigned readings in there. These are the learning objectives that we will be covering in this lecture. Please review them carefully. What is caring? Let's talk a little bit about what caring actually is before even jumping into caring and nursing, right? The definition of caring is that it's a universal phenomenon that influences the ways in which people think, feel, and behave in relation to one another. It's a complex and multifaceted activity. It is more important, especially in today's hectic world, our high-tech healthcare environment where productivity and efficiency are always given priority, and those interfere with our capacity to be caring, compassionate professionals. The environmental demands that we have as nurses, the pressure, the time constraints, the time crunch of you have to administer the medications in a certain amount, you have to get this done at this time, this needs to be documented, this needs to be charted. In this busy healthcare environment, it threatens our opportunity to establish a therapeutic relationship and connection with our patients and their family, right? And how do we do this? We do this by always maintaining a patient-centered approach. Remember, the patient is the focus of our care, right? Sincerity, being sincere to our patients. Listening, just taking the time in our busy day to listen to them. Being present for them. Respecting them for who they are. And accepting what their wishes, their preferences. Why care, right? Why even bother to care? Because it contributes to our clinical judgment. We make better decisions when we care about our patients, right? The health and well-being of our patients depends on us caring for them, right? Actually caring. It helps to create openness with patients. And what happens when you create that openness, that environment where they can share? They will share. Then it makes it easy for us to identify their risk factors and be able, give us the opportunity to help them, right? Improves patient satisfaction, improves patient outcomes. More we care, the better decisions we will make and more invested we will be in their care. And then it results in better patient outcomes. Cultural aspects of caring. Right? I mean, what is the cultural aspect of us providing care to our patients? It starts with collecting a culturally based nursing history. By letting patients tell their stories and listening to them, know and clarify their beliefs, their attitudes, their cultural practices regarding healthcare, caring practices, and end-of-life care. It's very important for us to know that. Right? Determine whether a member of the patient's family or cultural group, who in their family is the best resource to guide us in caring practices, such as providing presence or touching. Like in some families, touching is considered a bad thing. In some cultures, it's considered a therapeutic action. So reach out to the person in the family who can help guide you as to what's acceptable, what's not. Encourage the patient and family and caregiver, if appropriate, to share the perspective of the personal impact of their illness and trauma, right? And know the patient's cultural practices, such as, once again, touching, family involvement, or beliefs that impact uncertainty related to diagnoses, treatments, and outcomes of care. Just get to know the patient and their culture. And because it's very common for nurses to, especially when we care about our patients, it's a common practice over here where we'll touch their hand or we'll rub their back or we'll pat them on the shoulder, or our intention is to show caring, right? But then in some cultures that might not be acceptable. So it's very important to know what's acceptable in their culture. What are the guiding principles for caring, right? All team members are considered caregivers. It's not, hey, you're the physical therapist, don't touch my patient. No, we all are involved in providing care to the patient. Care is also based on continuous healing relationship. The goal is to heal. Care is customized, and it reflects the patient's needs and values and choices. It's the patient's preference. It's about the patient. And if you notice the diagram over here under thoughtful person-centered practice that's on this slide, what's in the center? It's the patient. The patient is always the focus, right? Care is provided in a healing environment of comfort, peace, and support. Family and friends of the patient are considered an essential part of the care team. A lot of times nurses, it's a tendency, sometimes it's a culture to, oh my God, here comes a sister who's a nurse, kind of attitude. But no, that's the best thing that can happen to us. Like, we need the family to be involved in the care, right? Patient safety is a priority. Transparency is the rule in the care of the patient. Be very transparent with the patient. All caregivers cooperate with one another through a common focus on the best interests and personal goals of the patient. The patient is the source of control for their care. Once again, the patient is the center of the focus. What do patients perceive, right? How do the patients perceive us and perceive the care that we provide to them? Right? Researchers use surveying tools such as the caring assessment tool, the CAT tool, to explore nursing care behaviors as perceived by the patients. Their findings emphasize and show that what patients expect from their caregivers, and this was used to help create guidelines for practice, right? What do the patients want from us as nurses? They appreciate the impact they want us to appreciate the impact of the illness on them and their family and caregiver. For example, we talked in the previous lecture about the single mom, right, who gets into a car accident. That patient wants us to understand how it has impacted her life. She's not just, somebody laying in a bed needing you to give them medications. She wants you to understand, hey, this is impacting me, please, look at me in a better light, right? Know what is important to them, understand that everybody has something that's important to them. It could be your kids, it could be your job, it could be your education, it could be your parents, it can be your spouse. Everybody has something important to them, right? So we need to know what's important to our patients. Know, listen, and be present. This was very important for patients. They feel like the nurse should listen to them and be present. Don't just go in there, scan the wristband, scan the medication, okay, here, leave it there, and walk out. No, be present, right? This led to patient satisfaction. Respect their values, beliefs, and healthcare choices by explaining these choices to them. Advocate for resources and accept their decisions. At the end of the day, they have that autonomy. They have that right to make that decision, and we have to respect it, even if we don't believe that's the right decision in our perception, right? But it's about them. It's their choice. Understand their story and listen by sitting and making eye contact, which is a huge thing, and it comes up again and again in practice. Is just listening to them. Just sit down and make eye contact. Sometimes that's all they need, and they open up to you, right? That's something that patients have that impacts them, right? Be present. Provide emotional and knowledge-based support. This led to confidence in their self-management and adherence. When patients had nurses who were present and they provided the emotional support and the knowledge that they need, it created confidence in them to manage their health and stick to the plan, adhere to the plan. So these findings emphasize what patients expect from caregivers and thus provide useful guidelines for your practice. Patients continue to value nurses' effectiveness in performing tasks. They love nurses who are good at their tasks, but clearly patients value the effective dimension of nursing, the part where they care, which reflects the art of nursing. Ethics of nursing and ethic of care. The relationship between the nurse's character and the attitude towards others and the patient. Remember ethics. It refers to the ideals of right and wrong, right? We talked about ethics last week. In any patient encounter, a nurse needs to know what behavior is ethically appropriate. Nurses do not make professional decisions based solely on just intellectual or analytical principles. Instead, an ethic of care places caring at the center of decision making. Nurses who function from an ethic of care are sensitive to unequal relationships that led to an abuse of one person's power over another, intentional or otherwise, right? In healthcare settings, patients and families are often on unequal footing with professionals because of the patient's illness, lack of information, regression caused by pain and suffering and unfamiliar circumstances. An ethic of care places the nurse as the patient's advocate. You advocate for your patient, and it influences the nurse's clinical judgment. We said caring influences your clinical judgment, and it helps guide clinical decision making regarding ethical dilemmas by attending to relationships and giving priority to each patient's unique personhood. How does caring in nursing look like? These are the qualities you see in nursing, right? These are provide presence, conveys closeness, just being there, being available, not just physically being there, but communicating and understanding. This helps to create that connection with our patient, right? Then we have the therapeutic touch, which is, this is holistic, evidence-based therapy. And it's evidence-based therapy, and it's an approved complementary and alternative medicine, just giving that therapeutic touch. Listening. To listen effectively, you need to silence yourself and listen with an open mind. Remain intentionally silent and concentrate on what the patient has to say. Give patients your full focused attention as they tell their stories. Through active listening, you actually begin to truly know your patients and what's important to them. Learning to listen to a patient is sometimes very difficult. It's easy to become distracted by tasks at hand. Okay, I have to get to my next patient, but colleagues shouting, instructors or other patients waiting to have their needs met. However, the time you take to listen effectively is worthwhile in both the information gained and the strengthening of the nurse-patient relationship. Know the patient. Factors that contribute to knowing the patient include time, continuity of care, teamwork of the nursing staff, trust, and experience. That's the reason why in a lot of hospitals, they're encouraging that continuity of care, right? You had this patient yesterday, you're going to have it again today, and if you're working 3 days in a row, tomorrow, because this helps to maintain that continuity. A lot of poor outcomes result from not knowing your patients. For example, in the acute care setting, not knowing patient contributes to risks of falls or actual falls. If you don't know that patient very well, you come to your shift in the morning and you don't know that this patient has a tendency to get up out of bed and supervised, then they might end up falling. But if you had that patient yesterday and you knew this is a patient that tends to do that, then you will be more cognizant. Spiritual caring. Spirituality offers a sense of connectedness interpersonally, with the patient, right? In a caring relationship, the patient and the nurse come to know each other so that both move toward a healing relationship, right? And then we have relieving symptoms of suffering. Reducing symptoms of suffering requires patient-centered caring actions to give patient comfort, dignity, respect, peace, and provide the comfort and support measures to the family and friend. Conveying a quiet, caring presence, touching a patient, or listening helps you to understand the meaning of your patient's discomfort. The caring presence helps you and your patient set desired outcomes for symptom relief. Then finally, we have family care. Each person experiences life through relationship with others. That's the reason why caring for an individual includes a person's family. And finally, we come down to being committed to caring. According to Jean Watson, the founder of the Caring Science, consistent with the wisdom and vision of Nightingale, nursing is a lifetime journey of caring and healing, seeking to understand and preserve the wholeness of human existence, and to offer compassionate, informed, knowledgeable human caring. That is it for our lecture on caring and nursing. Please go ahead and read the assigned chapters, and I will see you in class.